Hi guys, welcome to Healthy Living with Nosmo, the channel where health finally makes sense. And this week we have a new condition to talk about. This condition is something it's a condition that would affect majority of us at some point in our life, right? And we know people who this condition is affecting right now. Okay? And the condition is called osteoarthritis. Osteoarthritis. OA is osteoarthritis, and it's a condition that affects elderly people. It also affects young people, but very rarely. And if it does affect young people, it will be mostly athletes or people who have strained their joints or have had injury at some point. But this mostly affects elderly people and women. Okay. Again, we women, we have it on the shorter end of the stick, right? We have a lot of things that affect us. And I will tell us why it affects mostly women, okay, as compared to men. Okay, so come with me as we talk about osteoarthritis. So, what is osteoarthritis? Osteoarthritis, and I will just use OA in this video so I'm not like pronouncing the entire thing. Okay, but osteoarthritis is a degenerative joint disease. And when we say degenerative, we mean there is a wear and tear on the joints, okay? A wear and tear on the joints. It's the usage, the overtime usage of our joints, and it mostly affects the knees, the hip, the hands, okay, and the spine, okay. Those are the areas that are mostly affected, okay. Those are the joints that are mostly affected, like I said, the knee, the hips, the hands, and spine, okay. And so it's the wear and tear on those joints, all right. And did you know that about 73% of people living with osteoarthritis are older than 55-year-old? That's right. So our dads and our moms and our elderly people, we need to be on the lookout for them. They would mostly complain of like back pain, knee pain, leg pain. It's arthritis. It's coming on, and it's not because they did anything. It's just the wear and tear of that joint over the years, right? Because we know that as we get older, these muscles, this bone mass, everything is begins to weaken, okay? It gets weak. And so it affects them more. And that's why it's more prevalent in elderly people. So it affects 50 people who are above 55 years, and 60% of these people are women. Okay, they are females. Like I said, it affects mostly females, especially females that are already going into that menopause. Okay, because their bones become very weak and very brittle, and it's easy to have, or it's easier for them to have arthritis. Okay, and we'll discuss more on why they are more prone to having osteoarthritis than the male counterparts. Now, it happens when the joints gradually break down over time. The word there is breaking down over time, the usage of our body again. So how we use our body over the years really determine what's going to happen at the end of our towards the end of our lives, right? As we get older. Okay, so it's the that joint breakdown over time. Okay, it affects our cartilage and bones and the surrounding tissues. And mostly the people that I know that have osteoarthritis mostly always have it in the knee, because again, and the women that I know that have it is mostly in the knee. It starts with our knees, right? Knee pain, swelling in the knee, inflammation in that knee, and trying to get up becomes so difficult. Trying to move becomes so difficult, right? But again, it doesn't mean that we should stop moving. There's so much pain, but we need to keep moving. All right. It causes pain, stiffness, okay, and reduce movement. Because again, imagine that I'm sitting here and I try to get up and I do have osteoarthritis in my knee. It will take me some time to get up and move that leg as compared to someone who doesn't have any pain in their knee, any stiffness in their knee. Okay, so it causes pain, stiffness, and reduced movement. Okay, and like I said, the commonly affected joints are the knees, hip, hands, and the spine. Okay, that's why the back pain, the arms, okay, this aching, the knees are aching, the legs, it's those are the areas that it affects. OA, as I said I would call it for this video, is a chronic and progressive condition, right? But it can also develop slowly or quickly depending on the injury or the strain. Okay, if a person had an injury or if they had a strain, okay, so it can develop slowly or very quickly. Okay, but it's a chronic condition and it's very progressive. It's like it graduates, it advances, okay? Because again, it's sometimes for the knee, it's now bone on bone. Okay, the cartilage has been affected, and so some people it's just bone on bone grinding on each other, and that causes inflammation, that causes pain, that causes it that when they try to get up, it causes so much pain. Okay, and these changes can happen gradually over time. Okay, it can happen gradually over time. And that's why it's important that if you have elderly people or people who are, suffering from this condition, help them to move around, help them to get up, help them to, get into an activity, okay, as much as possible. Okay, so they can have some of the symptoms that we will talk about. Joint pain, number one symptom is joint pain. They will have joint pain depending on where it is. It could be the back, it could be, the areas that we did talk about that are mostly affected. There's joint pain. Stiffness, okay, especially from sitting in a position for a long time, and just after resting. I've been sitting here and I haven't been doing anything, right? When I try to get up, if I have osteoarthritis, it would hurt. It's there's that stiffness from trying to get up. There's that stiffness from trying to stretch that leg and move it, right? Okay. Swelling. You will notice that swelling. At first, from my experience, it doesn't look so obvious, but over time, the swelling can kind of build up. Okay. And so swelling is another symptom. So joint pain, stiffness, swelling, reduced ability to move that joint. Okay, just reduced ability. And because of the pain, majority of them try not to move it because they know that it's going to hurt. And so they don't want to get into any form of physical activity or moving at all. All right. And in very severe cases, it can make that joint unusable, and in the long term it will just cause more pain, constant pain. Even when they're resting, they could be sleeping and the pain just comes, and so now it's affecting their sleep. It's causing, it's affecting their activity of daily living. Someone who is able to walk and do things on their own and carry things on their own, like if we look at our elderly parents as they get older, you begin to wonder, oh, my dad or my mom that was able to do this, but they can't anymore. It's just old age. And then adding on to that, if they have osteoarthritis, it just makes it harder for them. Okay. So it's important that we're there for them, we're caring for them, we're helping them, we're supporting them, we're getting them to move around as much as possible. Okay. And that loss of that joint function can happen in severe cases. I've had people who have hip pain and they just can't use it. An example, I had a patient, um, is a 59-year-old man, and he has hip pain. He has osteoarthritis in his hip, and that bone is just from him not using it, and he just lays on one side for so long because that hurts, and that bone is just there. You can tell that there's something wrong, and so he needs a hip replacement because it hurts. He can't use it, he can't walk with his legs. And so that's in very severe cases. Okay, and we're going to talk about how to manage it, treatments, surgery options that are available. Okay, and so coming to what are the risk factors? What are the risk factors of osteoarthritis? The main risk factors is joint injury or just overuse of the joint. Sports, like I said, athletes, they tend to have this over time because they use their joints and their body a lot, right? Repetitive work or just again, example, nurses, doctors standing on their feet for so long, for hours, and it begins to affect the knee or affect the legs, the feet, or affect the back, the spine. So all of those things are very important. Like I'll use myself as an example. I love to use myself as an example. Since I started bedside, trust me, my back hasn't remained the same. it hasn't remained the same. So I try my best to, use safety measures when I'm at work and not to break my back, because if I don't have a back, then I can't care for my patients, right? So again, joint overuse or joint injury from sports or repetitive work. Okay. So if you have a job that's just repetitive and you're always on your feet, or you're an athlete, or you're into sport, you're into physical activity, very strenuous physical activity, very important that you're watching out for your joints and making sure that you're not doing anything to aggravate it, rather you're doing things to protect it. Okay. Aging, as we age, like I said, the joints are not the same. Okay, they get weaker, muscles get weaker, so it affects people who are of that are aging. Okay, being female is another risk factor. Okay, and this is due to, I said I will explain it, is due to hormonal changes. Women who go through menopause, they have weaker bone density, bone mass, and so that kind of causes osteoarthritis as well. And the anatomy of a woman's body, the hip ratio to the knee ratio, for people who have hips, wider hips, it can affect the knee as well, right? So that hip to knee ratio, so the way a woman's body is structured can affect, and that's why most of the time you will see women, and remember that most women will carry children with their body, their hip, and so that also have effect on over time on the knees, on those joints as well. And that's why women are more prone to having osteoarthritis than men. Obesity, just being obese and it causes extra stress on the body, on those joints, and causes inflammation as well. It increases that inflammation and just puts extra stress on those joints. So obesity is another risk factor. Genetics, like I said, if your dad or your mom had osteoarthritis, chances that you may have it. Okay, you're likely to have it. There's possibility of that, right? Because again, genetics is something that you can't really change. You could try your best to live a healthier life and do everything that you can, but if it's genetics and it happens, there's nothing much you could do about it. It's now up to you to control and manage it as much as you can. Rheumatoid arthritis is a risk factor for having osteoarthritis, diabetes as well. Okay, and like I said, diabetes is like the center of all kind of conditions, all kind of diseases. Okay, when you have diabetes, it's important that you take care of and control it and take care of your body, because things can go bad real quick. I had a patient I was speaking to his wife, right? And we were talking about it, and she was like, "Oh, he had stroke." And I was like, "I'm so sorry to hear that." And she was like, "Yeah, he wasn't taking his medication, and he wasn't adhering to the medications and doing what he needed to do." And that just brings me back to medication adherence. You don't like a medication, so it's not working for your body, speak to your doctor, but it doesn't mean that you should stop taking that medication. If you stop taking your blood pressure medication, guess what's going to happen over time? When the blood pressure will come back, it's going to be extremely high and it can lead to stroke, right? If you stop taking your medications for your blood sugar, and you have hyperglycemia and it's really high, your systems can shut down. Your systems can shut down, literally shut down. Okay. And so it's important that we adhere to our medication, take whatever the doctor is asking you to take. Again, if it's not working for you, or you feel like it's that medication is giving you some side effects that are really bad for you, discuss with your provider and see what other options they have for you, what other medications they have for you. Always advocate for yourself. Okay. And again, so we can see that from these risk factors that I've mentioned here, it's a combination of mechanical stress on the body over time. Okay, and also biological changes, genetics, a woman's body, and just wear and tear, and that use of that body. Okay, and it's not just wear and tear, but it's the mechanical stress on the joints, is the biological changes that happen to the body. Okay, and that wear and tear over time. Now, let's talk about the impact of OA, osteoarthritis, on the quality of life. And it really does. When you think about it, someone who's able to do so many things and move around and be active, and now they are restricted, their mobility is restricted because they have pain, and they don't even know how to deal with this pain. And there's only so much medications and pain medication that you can take and take and take, right? So it's a major cause. OA is a major cause of disability worldwide. It's a major cause of disability worldwide. And disability is just you not being able to do the things that you could do and move on your own and be able to, just do the basic needs for yourself, okay, and having to depend on mechanism and people and other things to help you support your daily life, right? So it can lead to reduced mobility, okay. Like I said, people who have osteoarthritis sometimes don't want to move that hand or the leg or the back. They just don't want to, because they know it causes pain for them, right? But it puts pain on their body, and so they reduce their movements. They don't really want to do much, okay. But again, not doing much is not going to help the situation. Doing something and moving around is actually going to help the situation. And that's what they don't really get. And that's why we need to educate and share this video. Okay. The other thing is it impacts their trouble. They have trouble walking or doing their daily task or just activities of daily living. Now, someone who used to stand and walk, example, a nurse who is able to take care of a patient for 12 hours, but then now there's knee pain, there's back pain, they can't do so much. If they're picking up 4 days before, they'll drop it down to 2 days maybe, and then it begins to degenerate and causes more problem, and now they can't work, okay. And that can leave a mental load on them, emotional and mental stress on a person. And so mental health issues, stress, okay, they're stressed about just not being able to do things on their own. They're stressed about the fact that if they move a certain way, it's pain, okay, and sleep problems as well. So because they're in pain, even when they're resting, in severe cases, they have sleep problems. They can't sleep properly. They can't rest properly, okay, unless they have like pain patch, um, maybe lidocaine patch, or they've taken pain medication, and that's the only way they're able to get some sleep. Okay. Increased risk of other disease, right? It can increase their risk of other disease because again, they won't be moving around, they won't be doing so much unless they have the right support system and they get the education to move around and do and get into physical activity rather than just restricting their mobility. And so it would lead to things like heart disease and other health conditions. Okay. So that OA impacts the quality of life so much. And so that's why these people who have osteoarthritis need a support system, need a healthcare worker, need somebody to motivate them, to educate them, and let them know that moving actually helps rather than not moving. Okay. Getting into a physical activity, moving those muscles, those joints will help you. Now let's talk about living with osteoarthritis. Living with osteoarthritis. Like I said, osteoarthritis is a common chronic and progressive condition, right? But it's manageable. We can try to manage it, okay, as much as possible. It doesn't mean that the pain is going to go away. It doesn't mean that they won't, on some days, they won't feel like not doing anything, okay? But for the most part, we want them to move. We want them to get into physical activity. We want them to be able to do those activities of daily living like they know how to. Okay. Now, staying active is one of the most effective ways to control the symptoms. Staying active is one of the most effective ways to control the symptoms of osteoarthritis. We think not moving and reducing mobility is won't let them feel the pain, but that staying active would help the joints even better. It might hurt at first, but over time it would help. Okay. exercise, strengthening exercise. Some of them might have to go for physical therapy, right? Exercises, it will strengthen the muscle, it will improve that mobility. Physical therapy is very big. Now, when you go for physical therapy as someone who has osteoarthritis, it might your muscles and your joint might hurt for a while just because your body is not used to. And if you haven't been physically active or someone who works out a lot, it would tell on your joints and your muscles, and they would try to fight you, going for that physical therapy. But again, keep going, keep showing up for yourself, because you have a right to take control of your body. Okay. Weight management. If you know that you need to lose weight, it's important that you lose weight. Okay. Like we said, staying active, getting into exercising, physical therapy is another one. Managing your weight. If you know that you're obese, you try to lose weight, try to manage the weight. Okay. Now, we also have orthopedic braces and assistive devices such as cane, walker, in the event that it becomes very severe and the person cannot walk on their own or they can't move on their own, they can use canes, walkers, splints. Okay, those are designed to help stabilize the joints, to help with mobility and reduce pain. Okay, pain medications can also help. In severe cases, a patient can be advised to undergo surgery. They can be advised to undergo joint replacement, right? It could be hip replacement, it could be knee replacement. I've had patients who have done joint hip replacement, knee replacement, um, spine surgery or surgery that can help with like the back pain, their hands. Okay, so it will help to reduce pain. It will restore movement. Okay, it will reduce pain, restore movement, and improve the quality of life. Okay, most people who are in severe cases of osteoarthritis always end up getting that joint replacement. Okay, because they know that it will improve that quality of life for most of them. If it's a severely affected joint, that surgery and that joint replacement will improve the quality of life, reduce pain, and help with mobility. Now, and this surgery are mostly common for the hip and the knee. I've had a lot of patients that have done hip and knee replacements. Okay, and then after that they go into like rehabilitation of how to use it, how to walk, get back to walking with that replacement. Okay, so that's like rehabilitation, and that will be done over maybe few weeks, few months depending, and they can get back to having a better quality of life. Okay, now remember that staying active and maintaining a healthy weight can help reduce symptoms and the risk of osteoarthritis progressing. Yes, you feel like you want to stay in a position and reduce mobility because it hurts from moving, but that staying active and reducing your weight would help reduce the symptoms, okay, and the risk of the condition progressing. Now, if you found this video helpful, please like, subscribe, and share to spread awareness about osteoarthritis. Okay, we have someone, it could be our elderly parents, it could be our uncles that we love dearly, aunties, anyone that has osteoarthritis, people who a friend dealing with it, brother, sister, share this to kind of help them to know that they need to move, they need to stay active. If they need to lose weight, let them watch this video, let them understand what's going on in their body and what they need to do. And I hope that this video helps someone out there, and I'll see you in my next video. Bye.